Do you have dizziness and wondered if seeing a chiropractor can help you? Have you been told dizziness comes from the neck and you're not sure? Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients struggling with dizziness for decades. Please note, these videos are not a substitute for professional medical or chiropractic advice, diagnosis, or treatment. These videos are strictly for informational and educational purposes only. Now, seeing the wrong doctor can result in an incomplete diagnosis, wrong treatment, and persistent symptoms with poor recovery or sometimes, unfortunately, no recovery. So let's jump in on this topic of dizziness. So just what is neck-related dizziness? Well, there is a type of dizziness that can come from neck problems. The medical term for this is called cervicogenic vertigo or cervicogenic dizziness. The word cervical means the cervical spine, genic means origin of. This dizziness is thought to be caused by a mismatch of signals in the brain. Now, here's an oversimplified explanation. Inside the neck are tissues that have nerve endings inside of them. These nerve endings are inside of joints, they're inside of ligaments, they're inside of other structures, and they communicate body position to the brain. For example, I have this finger behind my head, finger sticking up, fingers bent down. I can tell without seeing my finger or touching it if it's straight or if it's bent. How is that? It's because there's communication to the brain from tissues inside the joints. So if the neck is injured or for some reason doesn't work right, becomes dysfunctional, the information coming out of the joints and going to the brain can be corrupted. This corruption does not match, so the corrupted signals do not match what the brain is expecting. This mismatch can result in many things, such as dizziness. So what can cause this mismatch? Well, this can develop over time following a neck injury. It can develop over time in response to other conditions such as degeneration of the neck, or from gradual weakening, or from poor posture. There are other conditions, of course, too. Now, how is this diagnosed? Here's the challenge. It is difficult to distinguish neck-related dizziness from other types of dizziness, such as inner ear, vascular, that's problems with blood vessels, or other neurological processes, such as issues going on inside the brain. So it is called a diagnosis of exclusion. Well, what does that mean? Well, first, you have to rule everything else out. You have to exclude everything else. You have to rule out problems with the inner ear. You have to rule out problems with the blood vessels. You have to rule out problems with the brain. And if all that remains is the person has a neck condition and dizziness, you rule in that it's called cervicogenic dizziness. Now, other symptoms that are oftentimes associated with this dizziness are neck pain, but there might also be other ones such as coordination issues, balance issues, a sense of floating versus true spinning. Sometimes there's visual disturbances, sometimes there's visual fatigue, sometimes nausea, and of course, as we mentioned before, even headaches. This dizziness can be triggered or reproduced by being in awkward neck positions or postures, especially if you have to sustain them for a long period of time. So how is this treated? True cervicogenic dizziness responds best to manual treatments. So that would be spinal adjusting that chiropractors provide, muscle therapy, and sometimes exercises are even needed. Occasionally, inner ear exercises are also needed too. So if you or someone you know was suffering from dizziness, get examined right away. We make sure to rule out that there's not other issues, but we can then rule this one in and help you. So give us a call at 651-925-5530 to schedule an examination. In closing, thank you for taking time to listen to this video. You have many voices to pick from, and I'm honored that you chose mine. It's my hope that this information helped you with your decision making, and I wish you all the best. And until next time, be blessed.